antidepressant effects of the psychedelic ayahuasca. Thank you, Raul.
So, good morning, everyone. It's, in fact, a great pleasure to be here. I'd like to thank all the organizing committee, Pepe, Francisco, Carolina, Valentina, and all the BNI crew that organized this symposium. It's really nice. It's a really nice opportunity to be here and to know people from Latin America, as Pepe mentioned yesterday. We are close, but we are far somehow. So thank to the BNI for organizing this, for the endeavor of having this and putting this together. Congratulations and thank you. So my idea here is to bring you an overview of the last 11 years that we have been working with this substance, ayahuasca. We've been conducting basically two lines of research. In the first one, we're interested in understanding the neural basis of ayahuasca. And in the second line of research, we're interested in understanding and testing the antidepressant effects of ayahuasca. So what is ayahuasca? Ayahuasca is a substance that comes from the Indians in the Amazonian basin. So here we see all the Amazonian basin, and ayahuasca have been registered in many different parts of the Amazonian basin, mostly in this region here, and the north part of Brazil, and the northwest part of Brazil, and Peru, Colombia, and these regions here of the Amazonian basin. Traditionally, ayahuasca is used in many different rituals that goes from rituals for curative purposes to war. So there are some evidences that the Indians used ayahuasca also to go to war. But mostly, ayahuasca is used traditionally as a medicine in many perspectives, as a medicine that's used with a shaman, as a medicine that's used to guide the tribe, as a medicine that's used to cure some of the people of the tribe. From the pharmacological point of view, ayahuasca is, very interestingly, by the way, is a mixture of two plants. The leaves of Psychotria viridis, if you know a coffee plant, it looks pretty much like a coffee plant. It is from the same family as the coffee. So you mixture the leaves of Psychotria viridis with the bark of this other plant, Banisteriopsis caapi. You mix them together and you do a decoction for hours, for about 12 hours of cooking. And when you do these 12 hours of cooking, you end up with this brown liquid with a very weird taste, a bitter and a sour taste. Ayahuasca has these two main components. Psychotria viridis has the dimethyltryptamine, and Banisteriopsis caapi has a number of monoamine oxidase inhibitors. Dimethyltryptamine is the substance in ayahuasca, is the element in ayahuasca that brings most of the psychedelic properties of ayahuasca. It is a serotonergic agonist, and it recently have been found to be also a sigma-1 agonist. Curiously, ayahuasca and dimethyltryptamine exist endogenously, although the function of the endogenous function of dimethyltryptamine is still unknown. The fact is that if you drink dimethyltryptamine, it's going to get degraded by monoamine oxidase that we have in our gut. So some people use dimethyltryptamine isolated, but in order to have the effects, people either smoke it or mostly smoke it. If you ingest it, then you won't have the psychoactive principles. But it turns out that the other plant, the Banisteriopsis caapi, has a number of monoamine oxidase inhibitors, such as harmine, harmaline, and tetrahydroharmine. And when you mix these two plants, what happens is that the monoamine oxidase inhibitors protect dimethyltryptamine from being degraded of the monoamine oxidase that we have in our gut. How the Indians found that, that's a nice question, because we're talking about the Amazonian rainforest. It's not a beach that has 2 or 3 plants. And somehow they found out that by mixing these 2 plants, you could still have the psychoactive principle of dimethyltryptamine, even if you ingest it. Right now, ayahuasca, in 1930s, ayahuasca reached the urban centers in Brazil. And it's now used in 3 main religions in Brazil, and ayahuasca is used as their main sacrament. There are estimates today that about 20,000 people in Brazil drink ayahuasca every 2 weeks. So that brings a good notion of the safety pattern, the safety of ayahuasca. So it is relatively safe if you consider that 20,000 people drink ayahuasca every 2 weeks. So that's a good information. That's a good piece of information. And recent studies have shown that the alterations that comes with ayahuasca from the autonomic nervous system, so considering blood pressure, heart rate, pupil diameter, and these measurements, during the effects of ayahuasca, these measurements are kept within a safety standard. What is the main risk of ayahuasca? So as any substance, ayahuasca also has its risk. And the main risk of ayahuasca is starting what we call the first psychotic outbreak. And this might happen particularly in people that are prone to have a psychotic outbreak, which means that most of the studies that we have been conducting or other people have been conducting with psychedelic substances, we have to watch out for people that we think are prone for the first psychotic outbreak. And these people are basically individuals that have family history of schizophrenia or that has a schizophrenia, and individuals that have diagnosed with bipolar disorders. So generally, these group of people are not included in the studies with ayahuasca. The effects of ayahuasca are very broad. It has a very broad spectrum in what kind of functions ayahuasca changes. So that's why we consider ayahuasca as a substance that leads you to an altered state of consciousness. And by altered state of consciousness from what? From this ordinary state of consciousness that we are most of our time, which means that we can somehow compare the altered state of consciousness that's brought by ayahuasca with an altered state of consciousness that we have in our everyday life, which is going to sleep. So when we go to sleep, a lot of things change. It changes how we deal with ourselves. It changes how we deal with the external world. It has some pseudo hallucinations with dream. So there are many parallels between the effects of ayahuasca and what happens during sleep. As a matter of fact, I believe that when we were a kid, we didn't want to go to sleep, in part because we were afraid of entering that thing that we don't really know what it is. So we fight against going to sleep when we were a kid for long, and there are some speculation behind that. That's because kids are afraid of going into that different state of consciousness. And that's the same with ayahuasca. A lot of people are afraid of drinking ayahuasca, of having the psychedelic experience, and that's totally understood in the fact that you're going to go into this altered state of consciousness. You're not going to lose control, but you're going to go in this altered state of consciousness. Very interestingly, and this is a difference between the altered state of consciousness brought by sleep and the altered state of consciousness brought by ayahuasca, during the ayahuasca experience, it's very rare to lose track of this reality, which I like to call the Babylon. So we don't lose track of the Babylon. We are always in the Babylon somehow. We know that all these effects are from that substance that you're drinking. You know that what's happening to you is due to ayahuasca, although a lot of time you just don't have, you have a lot of difficulty on dealing with that different experience. What are then the main effects of ayahuasca? The most well-known effect of ayahuasca is what some people call hallucinations. But that's not the correct technical term, because when you have hallucination is a term that's defined with the eyes open. So in order to have an hallucination, a defined hallucination, you have to have the visions projected into the physical world. When you have your eyes closed, that's not an hallucination. So when you're dreaming, you're not hallucinating. You're just gaining the ability to see whatever it is with your eyes closed. When you open your eyes, that's it, that's gone. A lot of time, and most of the time, what happens with ayahuasca is that the visions that come with the ayahuasca experience, they mostly come with your eyes closed, not with your eyes open. The other effect that's really well known with ayahuasca is it induces a lot of nausea. In about 95% of the people that drink ayahuasca, they report nausea. Some of them evolve to vomiting. About 30 to 40% of people end up vomiting. And to a lesser extent, it can also develop as a diarrhea. This, to me, is very important, and it's a very specific aspect of ayahuasca when you compare to different psychedelics, because it's more difficult to understand ayahuasca as a recreational substance. I mean, to me, it's very difficult to think of watching the game of yesterday under the effect of ayahuasca. So it's very hard for me to consider to go to a party under the effect of ayahuasca. So one important point I want to make is that these kind of substances, and particularly ayahuasca, might be helpful if used in the right context and for the right purpose. So different from other substances, these kind of substances, context and purpose are very important. And ayahuasca also have another important effect of ayahuasca, and well-known effect of ayahuasca. Its relation with what we call the mystical experiences. As a matter of fact, as I just told you, ayahuasca is used as a sacrament for 3 different religions in Brazil. So it has somehow a relationship between the effects of ayahuasca and the mystical experiences that are brought under the effect of ayahuasca. So the first couple of studies that we did involved understanding the neural basis of ayahuasca. So understanding how is it that ayahuasca interacts with the human brain. In order to do that, in 2007, we started this project with all of our individuals were experienced users of ayahuasca in one of the churches in São Paulo. So we recruited 12 individuals from this church with at least 10 years of experience with ayahuasca. So we had subjects that had 10 years of experience up to 30 years of experience with ayahuasca. So they were really experienced with ayahuasca. And the reason why we decided to start with it was that was our first project with ayahuasca. And vomiting, as I said, is a common effect of ayahuasca. And this study involved having these individuals inside an MRI. So you don't want to have people vomiting in an MRI first. You don't want to have people having their first experience, their first psychedelic experience in the MRI machine. You want to have people that can handle that experience, that can understand that experience, and that can have a much easier relationship between that altered state of consciousness with the Babylon. Because in this experiment, we asked the subjects to perform a couple of tasks. And at the beginning, it's very difficult. At the first experience with ayahuasca, what you're trying to do, basically, is trying to deal with the experience. So it is as if you're asking someone that doesn't surf to have their first surf ride in Pipeline in Hawaii. So you start slowly. You start, going to Brazil, and then you come to Chile, and then you go to Hawaii. The first study then we did with these subjects was to try to understand the neural basis of the visions. So trying to understand where do the visions come from with the interaction of ayahuasca and the visions. So in this paradigm, in this functional magnetic resonance paradigm, basically what we did was to have the individuals going through the same task twice. Once before the effects of ayahuasca as a baseline measurement. And the second one, so we have the individuals in the scanner. We ran the protocol, got the individuals out of the scanner. They drank their regular amount of ayahuasca that they drink in the church. After 40 minutes, when the effects of ayahuasca start kicking in, we had them again in the MRI performing the whole batch of experiments that we did. And then about 1 hour later, they're out of the equipment again. I didn't mention, but the effects of ayahuasca last for about 4 hours. The effects start kicking in at 40 minutes, and it lasts at 4 hours. 4 hours later, you are already back to the Babylon. What we found was, so these results that I'm showing here are the areas that got modulated by ayahuasca and the task of a mental imagery task, an imagination task. So they were imagining different images from seeds that we provided. And these regions here are the ones that had an increased activation during the effects of ayahuasca when they were imagining, they were trying to imagine something. And very interestingly, what we see here, what you see in this, these shadow areas here are the retinotopic mapping of these individuals. And what you see here are the areas that got boosted up during the ayahuasca effects together with the imagination protocol. So you see the involvement of visual areas, including the primary visual area, Brodmann area 17, mediotemporal areas, the parahippocampal gyrus, the hippocampus, and part of the amygdala, and the frontal polar cortex, BA10, asymmetrically to the right hemisphere. Here you see that, curiously, the signal in the primary visual cortex correlates with a scale that measures the amount of visual symptoms that these individuals had. So from our first perspective of this experiment, what we found is that, in fact, what might be happening with this data is that, in fact, the people see something. And they see something because, in part, you have an engagement of our visual system. And that's interesting because if you close your eyes right now and try to imagine something from the beach or whatever, you're not going to see it. You're going to imagine, but you're not going to see it. What we are proposing here is that, in fact, with the activation of the primary visual cortex and with the correlation of the activation of the primary visual cortex with the scales that measure the visions, it might be that what we are seeing is the effects of ayahuasca as something that the individuals are seeing, their own imagination. Oops. Okay, one thing that then from this first set of experiment, we decided to move forward, and that's basically what we have been doing in the last 10 years, is to understand what the visions are then. If they're seeing something, what is it that they're seeing? And so we started to look at these regions besides the primary visual cortex. We started looking at different areas of the brain that got modulated, particularly the frontal polar cortex, as you see here. And why was it that we were interested in the frontal polar cortex? Because if you look at these studies here, this is our study, and these are two studies, one with introspection and this other one with lucid dreaming. You do see a very nice correspondence between what we found and what people have been finding during lucid dreaming, with a higher engagement of this area, of the frontal polar area. What does it mean? It means that what is lucid dreaming? So lucid dreaming is basically you gaining the ability of be aware of your own dreams, right? So you are aware that you're dreaming. So that brings an important and interesting evidence that it might be that these individuals are just aware of their own visions. They're just getting more aware of their own visions. So moving a little bit forward, last year, 2 years ago, there was this paper showing that basically when you stimulate this area, which is on the right side of the brain, when you stimulate the frontal polar cortex, there is an interesting change that happens in the stream of thought. So what these people have done is to understand how much of what we call a mind wandering is changed when you have these areas being stimulated. What is mind wandering? Mind wandering is basically what all of you have done already here in this talk, which is you're looking at me, but your mind is not here anymore. You're just bumped. You're out somewhere. And then you're like, oh, I got to come back. And then you come back and you're out. And then you come back and then you're out. So you're unaware to the process of spontaneous thinking. You're looking at me and all of a sudden you get abducted by these thoughts. You're not aware that you're abducted by this thought. And then all of a sudden you gain awareness again and you're like, oops, I got to come back. And then you're aware that you are away. Curiously, these processes of unaware thinking get reduced when you stimulate the frontal polar cortex. So together with this, we also investigated the default mode network, which Tomás is going to talk following this talk. So I'm not going to go into the details of the default mode network. But what we found was significant changes in the default mode network of these individuals. And the changes we found are closely related to the changes that people have found during meditation. So what we found was a decreased activity of the default mode network for the most part, and a decreased connectivity of the posterior cingulate cortex, that what you see here, and an increased activity of the salience network. These three findings co-occur during the experience of ayahuasca and during a meditation task. So during the meditation task, you also have a decreased activity of the default mode network for the most part. You have a decreased connectivity of the posterior cingulate cortex, and you have an increased connectivity of the salience network. So what is our hypothesis, and where is it that we're going? Where is it that we are moving? Right now, our hypothesis is that basically one of the effects of ayahuasca might be that's giving you the possibility of seeing your own thoughts, of seeing your own stream of thoughts. There are some new evidences, especially electrophysiological evidences, showing, for instance, that during the effects of ayahuasca, you have a decrease in alpha activity. And as we all know, the alpha activity seems to be an inhibitory activity on the visual system in order to inhibit the visions when you have your eyes closed. So putting this whole thing together, our hypothesis, and this is where we are moving, is to understand if, in fact, what we do in part is the visions come from our own thoughts, from our own experience. Moving a little bit forward, then for the second line of research, this is the first line of research. This is what we're doing for investigating the neurobasis. The second line of research involves studying the antidepressant effects of ayahuasca. Very curiously, when we started having contact with people in the church in Brazil that uses ayahuasca, two characteristics became very evident. The first one was that a lot of people in the church would say that they got better from their depression. And the second thing was a lot of people in the church would say that they would get better from their addiction problem. Addiction to alcohol, addiction to tobacco, addiction to cocaine, addiction to crack, and sometime addiction to heroin. So we decided to start in 2008. We decided to start, and we picked up one, and we decided to move forward, trying to investigate the antidepressant effects of ayahuasca. So the first study we did, so some facts about depression. About 305 million people, 35, oh, whatever, they suffer from depression. About 30% do not respond to the current available treatment for depression. And most of the antidepressant medication take about 2 weeks in order for the effects to kick in. And this we can observe here. This is the largest study for one of the most used medicines for depression, most used antidepressant, fluoxetine. And what you see here is the number of weeks, so 2 weeks, 4 weeks, 6 weeks, 8 weeks, until 13 weeks. And in red, you see the remission rate, which is the percentage of people that got cured, that doesn't have any depressive symptoms anymore. And in purple, you see people that present a response. And response is defined as those people that reduce their symptoms in 50%. What you see here is that about 25% get remission after 4 weeks of treatment, but the effects start kicking in after 2 weeks. And that's the highest it goes. So it goes up to 30%. So fluoxetine has an efficiency of about 25% to 30%. So this is the first study we did with ayahuasca. This is a pilot study that we designed to investigate mainly 2 things. The first one is the safety of giving ayahuasca inside a hospital. Because ayahuasca is traditionally given in a ritual setting. So how is it that we bring ayahuasca into a hospital? Well, people deal with the experience the same way they deal while they're in a ritual. So testing the safety. The second thing was to preliminarily test the antidepressant effects. So what you see here are 2 scales, the Hamilton D scale here and the Madras scale. Those are 2 clinical scales designed to measure the depressive symptoms. So it has to be applied by a psychiatrist, so it's a clinically based scale. Part of this scale is designed to understand how the patient is feeling, and part of this scale is designed as a third-person perspective in which the psychiatrist evaluates the patient in a third-person perspective. These 2 scales have the same characteristics, and what you see here is the higher the number, the more severe the patient is. This is time. So this is minus 10 minutes. So it's the baseline measurement before the beginning of the ayahuasca session. And this is during the ayahuasca session. This is 1 day after, 7 days, 14 days, and 21 days. These 6 patients, they were kept in the hospital for 21 days, and they were out of any medications for 21 days, any antidepressant medications for 21 days. Very curiously, and to me, this is the most interesting aspect of our data, is that ayahuasca seems to have a rapid antidepressant effect. So we do see already an antidepressant effect that happens 1 day after dosing. And curiously, after a single intervention, so we only had a single intervention with ayahuasca, a single dose of ayahuasca, those effects persisted for 21 days. So we decided to move forward. We increased the number of patients to 17. And what you observe here, and we also added I SPECT analysis 8 hours after the experience. So 8 hours after the experience, we had these individuals in a SPECT machine to evaluate blood flow. So consistent with the other study we had, what you see here is a significant decrease of, these are the 2 scales. So in red, you see the Madras scale. Here you see the Hamilton D scale. And this pink line here is what we call a CADS scale that measures dissociative symptoms. So this is just to say that the individuals had a psychedelic effect during the session. And this other scale in green measures mania-like symptoms. So one concern we had, and trying to investigate the safety of ayahuasca, was to check whether or not ayahuasca would give a mania type of symptom during the acute effects. And it doesn't, apparently, at least in unipolar. So all these patients are unipolar treatment-resistant patients. So again, what you see is a significant decrease in these scales 1 day after, which persisted for 21 days. what's the main problem of these studies and with any study that use this type of design, which we call open label design, is that we are not controlling for the placebo. And placebo effect is very important in depression, so that you know the placebo response in clinical trial for depression can reach up to 40%. Which means that 40% of the patients that you recruit, 40% of treatment-resistant depression patients, so very severely impaired patients, about 40% respond to a treatment with a placebo. So what happens is that our result could be just an artifact from a placebo response and not an actual response from ayahuasca itself. And the reason why you have such a high placebo effect in depression and in these patients is that all these patients in treatment-resistant depression, it's a new hope. I mean, you're asking a patient to come to a hospital to try an experimental treatment. And as we all know, experimental treatment has a lot of power in our mind. I mean, you're going to be tested for this fancy thing, and then you have a high placebo response. So because of that, in 2010, we started planning the randomized controlled trial. So we did a randomized controlled trial. We started in actually we started planning the randomized controlled trial in 2010, 2011. Naturally, as you might know, there's a lot of difficulties in having these type of studies approved, more than if I were studying something that didn't have a psychoactive effect, that didn't have an Indian origin, and that didn't have a religious basis. So we kind of putting together all the taboos besides sex. The only one that is a drug, it comes from the Indian, so it's race, and it has a religion related to it. So we did, but we got it approved after about 3 years. We had it approved in the ethics committee. So at the end of 2013, we got our approval, we got our financial support, and we started conducting this experiment in 2014, in January 2014. But we decided, as we were going to go through the hassle of doing a randomized controlled trial, we decided to have it as a more comprehensive project. So we decided to, in a single project, we decided that we had the chance of investigating not only the antidepressant effects of ayahuasca, but putting together a project in which you could understand the subacute effects of ayahuasca, the antidepressant effects of ayahuasca, and the acute effects of ayahuasca. So how was it that we designed the protocol? This was very time-consuming because, as I said, we started data acquisition in 2014, and we finished, this is actually December 2016, and the reason why it took so long, in part, was because we had a 4-day experiment with each individual that we recruited to the experiment. And as we wanted to have this more comprehensive project, we did not have only patients with depression recruited to this study. We also had healthy subjects recruited to the study. Between healthy subjects and patients, we had 85 individuals participating in this trial. And these 85 individuals, they went through a 4 days experimental session. And why is it that we had them for 4 days? So we had a really tight schedule in the sense that all the experiments had to run from Tuesday to Friday. So on Tuesday, the volunteers got to the lab. We had a psychiatry evaluation, a neuropsychological evaluation, an MRI and an fMRI taken, an EEG preparation, and then they slept in the lab from Tuesday to Wednesday. On Wednesday, they wake up in the lab. We have blood and saliva samples taken from them. At 8 hours, we started the preparation for the session, for the dosing session. At about 10 o'clock, they started their dosing session, either with ayahuasca or the placebo. It's a parallel arm study, so it means that half of our individuals were under a session with ayahuasca and the other half with the placebo. Then we did the dosing session. During the dosing session, we had them in EEG, we had saliva, and we have a number of questionnaires that we applied right after the dosing session. They return home or they stay in the hospital, depending on the condition of the patient or if they were on the healthy group. And then on Thursday, they come back to the lab and they repeat the whole battery of exams again. So it means that with this experiment, here we had the possibility to understand the acute effects of ayahuasca. With this data, before and after the experience, we have a chance to understand the subacute effects of ayahuasca in many different markers. And as psychiatry evaluation goes, we evaluated the individuals 1 day after dosing, 2 days, 7 days, 14 days, and then every month until 6 months. This is a very important issue on conducting randomized trials with psychedelics or with psychoactive substances, which is, if you're conducting a randomized trial, you want to preserve blindness. You want to preserve blindness from the patient, and you want to preserve blindness from whoever is evaluated, meaning that you don't want the investigator nor the patient knowing that they're taking ayahuasca or placebo. So how is it that you're going to hide from someone that drank ayahuasca that they drank ayahuasca? You're not. So for these studies, it's very important to work out the placebo. So the only thing we can do is to boost up the response of the placebo, trying to bring some confusion to the patient on whether they've drunk ayahuasca or the placebo when they drink the placebo. Because when they drink ayahuasca, they know that they drank ayahuasca. And that's what happened in our study. 100%. At the end, we asked, do you think you had the placebo? Do you think, or you had ayahuasca? 100% of the people that had ayahuasca said, yes, I had ayahuasca. But not 100% of the people that had the placebo said, I had the placebo. And why is it? Because our placebo included, it's not a psychoactive. We didn't want to play with psychoactive because, then you have a confounding effect of the antidepressant effect itself. What is a substance that you can have a psychoactive effect and you're sure that that doesn't have an antidepressant effect? So we decided to go with the other kind of effects that ayahuasca has, which is the nausea. We had a zinc sulfur in the placebo. So the placebo, this is important to say, all our subjects are naive. So this is their first experience with psychedelics, so they didn't know what to expect. The second thing is that we told them, you could have from nothing to a full effect, and then we described the full effect. So they are all naive. And the placebo then is brown. It has a bitter taste. It has a sour taste. It tastes weird as well. And it brings some nausea. So about 30% of all individuals had the nausea. 2 vomited and 1 had diarrhea. So it's efficient. It's an efficient placebo. This is the trial protocol. This is the trial protocol. What you see here is we evaluated about 218 patients. We randomized just 35 patients. And why is it that we randomized only 35 patients? Due to the inclusion and exclusion criteria, including the risk of having ayahuasca in people with bipolar disorder and with schizophrenia or family history of schizophrenia. And all the patients had to have what we define as treatment-resistant depression. And by treatment-resistant depression, we understand a patient who have tried at least 2 different antidepressant medications from different classes. And in average, our patients had 3.6. They have tried 3.6 different medications before participating in our trial. But we had patients that tried 18 different medications and 12 different sessions of electroconvulsive therapy. Patients who already tried electroconvulsive therapy. So they're really the patients very severely impaired. So as I said, half went to an ayahuasca session and half went through a placebo session. The other important thing that's very different from any other substance that psychedelics have is the idea that you need to have an adequate set and an adequate setting. So what is set? Set is how you feel. So the experience of psychedelics are really determined or has a dependency on how you are. And in this sense, the set of half of our individuals were very different from the set of the other half of the individuals, because half had depression and half didn't. The second thing, the setting, is the context. So what is the context that you're going to have these patients having their first psychedelic experience? So this is the environment where we conducted all of our experiments. So it's a room, it's a hospital room, it's a very clean, and it doesn't have a lot of information, in the sense that it doesn't have a lot of hanging around or pictures. It just have a couple of squares, and it doesn't have a lot of things. So the people just sit in this recliner and stay in this recliner for 4 hours with an EEG hooked up. And every once in a while, a psychiatrist will walk in, do an evaluation, and two of our people of our team, myself and someone else, would follow the patient very closely by staying in this room next door. So we would be there, they would know that we would be there, and we would only reach for them in cases that we found they need help somehow. So there isn't really much you can do. At the beginning, one thing I used to tell them is that it is as if you are going into a bus. But the moment you enter the bus, I will lose contact with the bus driver. And I can't do anything until the bus driver decides to stop. When the bus driver stops, I'll be there waiting for you. That was the only thing I could tell them, because there's nothing I could do to take them out of that state, even when they didn't want to be there. These are the results, the first set of results. So as I said, this is there's a lot of data we have to analyze. The data I'm bringing here is only the antidepressant, the clinical data from the psychiatry perspective. This is the first set of data we have from the MADRS score, one of those scales that measure the depressive severity. In red, you have the group, the ayahuasca group. In blue, you have the placebo group. What you see is that one day after, the between group difference is already significant. It's still different at day 2 and increases the difference at day 7. But it increases the difference at day 7 because people in the placebo group worsen, and people in the ayahuasca group kept better. The other thing I want to mention is that in the other study, as I've mentioned, we evaluated the patients for 21 days. Why is it that I'm only showing 7 days here? Because in the first experiment, as it was an open label trial, all the patients were being treated with ayahuasca. So the ethics committee understood that we could keep the patients for 21 days without giving them a new medications as they were treated with this experimental substance, and they allowed us to keep the patients in the hospital. So we were allowed to have them free of medications for 21 days as long as they stayed in the hospital. With this, we were not, as we had a placebo group, then there's no way you can keep someone after a placebo intervention. So it's not correct to keep someone after an intervention with a placebo for 21 days, even in the hospital. So they allowed us to keep the patients for 7 days without a new treatment. So all these patients, they come to the clinic because their actual treatment is not working. So as it is not working, they come. the FDA to approve anything new, it has to have an effect size of at least 0.6. And what we see here is that the effect size is kept high for day 1 and day 2, and it increases to 1.49 at day 7. So it's a very high effect size at day 7. We can look at this data differently. So this is the same data, but we're evaluating what we call response rate and remission rate. This I find very interesting to appreciate one thing, which is the placebo response. The placebo response here is shown in blue, and this is the response rate. What is the response rate, again? Is the number of individuals that reduce their symptoms by 50%. So they had a score of 30. If in the day of evaluation they have a new score of 15, then they are called responder. You see a very high response rate in the placebo group. So you have a response rate of about 50%. This is 50%. This is 46%. This is 50%. This is 77%. This is 64%. So at day 2, 64% of the individuals were having a high placebo response. At day 7, then the placebo response reduces to 26, and the ayahuasca response is kept high at 64%. Why is it that we had such a high placebo response? In part, it's because it's not a pure placebo response. These individuals stayed in the hospital for 4 days. So day 1 and day 2, they were still in the hospital. The second thing we have to consider is that most of our individuals come from a very low socioeconomic status. The city where we conducted this experiment is one of the poorest part of Brazil. It's a city called Natal, in the northeast of Brazil. It's a very poor part of the country. So about 80% of our subjects had a very low socioeconomic status, which means that when they come to the hospital, they feel like they're in a 5-star hotel. Some of our subjects ask not to go home. They could go home on Wednesday, and they could go home on Friday. Some of them asked to spend the weekend in the hospital. And why is it? Because when they go back home, they're back to their high-level Babylon of a lot of problems. But very curiously, what you see is that 7 days after, when they are already back home, the placebo response reduces then, because they don't have what we call, we're not calling then a placebo response, we're calling a care effect. Because, all the crew were really helpful to the patients. The patients were being listened, the patients were being taken care of, the patients could listen to music, could watch TV, could do things that they have a really hard time doing at home. So it is to be expected of this higher placebo response. This is the type of experience that our individuals faced. So you see here one important thing and an important point of ayahuasca, which is it's not necessarily a pleasant experience. One thing we found in our patients is that they tend to suffer a lot more than the control group. This is a drawing from a patient representing his psychedelic experience. And when I got this drawing, I asked, why is it that you draw it in black and white? I mean, if you look at it, if you Google psychedelics, colors will be all over the place. And he said, well, because all my visions were black and white. I've never seen that. I've never seen someone in the church or whatever having a visual experience that comes in black and white. And what does this represent? This represents what he called the essence of pain. He was in pain for 4 hours. Mental pain, physical pain, everything. He threw up very bad. He had a very tough experience, The other point I want to make here is, so the first point, it's not pleasant necessarily. For most of the time, it's not pleasant. It's difficult. It's a kind of a difficult experience. As a matter of fact, in the religions, they call it a work. They call it to go to work. They don't call it to go to, they go to work. Today is a day of work. That's how they refer to the experience. The second point I want to make, it refers to then the next step of this research, which is, where does these antidepressant effects come from? Is it a chemically driven change together with a more psychological change, or is it just a chemical driven change and no psychological effect is taking place? The chemical aspect of it, it's very clear for us because dimethyltryptamine, so ayahuasca contains two substances that separately have been used traditionally as an antidepressant medication, which is the agonism of serotonergic cascade. So dimethyltryptamine is a serotonin agonist. And the other is monoamine oxidase inhibitors. So a number of monoamine oxidase inhibitors have been tested against depression, like Harmine, and it seems to have a significant antidepressant effect. Harmine, for instance, have been shown to produce neurogenesis in the hippocampus, which seems to be a good marker of improvement from depression. So we have some biological markers that help us understanding the antidepressant effects of ayahuasca. But the second point I want to make comes from the reports of our individuals. So some of the individuals say that they did not like the experience for the same reasons they don't like psychotherapy. Some people say, it feels like I did 1 year of psychotherapy in 4 hours. So we have to acknowledge that part of these effects come from a more psychological explanation than a chemically based and exclusively based explanation. So it is as if we are talking about things that are more subtle than just saying that your brain received a batch of serotonin. We're talking about processes that are just as subtle. Naturally, they're neurochemically driven, but it's a lot more subtle than the models we have nowadays of reproducing these effects as a global increase of serotonin. I'm not speaking to you right now because I have a global increase of any neurotransmitter. I'm speaking to you right now because there are a lot of subtle events happening in my brain right now that we are far from understanding, but that governs somehow this psychological events of speaking, for instance. The other thing is the visions are also important, like in this report that this patient, she was in a coffin. She felt she was in a coffin. She tried suicide 3 times. And the visions she had was that she was in a coffin. Her mother was right next to her in the coffin. And she was trying to tell her mother that she was not dead. And she couldn't move. This other one, she saw her sister who was dead. She talked to her sister. So what I'm trying the point I'm trying to make is that the visions can be as simple as geometric colored images, but it can raise up to very complex conversation as this one of someone speaking to her dead sister and her dead sister telling her that she should take care of her life, that she was fine. And more, I'd say, physical effects, like this one of this patient. She threw up, and at the end of the experience, she asked me if I've seen that red ball that she had just vomited. And I said, no, I didn't. And she was like, when I was vomiting, I was trying to point you out the red ball, and this red ball was here, stuck in here for years. And today, finally, I threw it up. So this is, as I said, it's a huge study. So I'm here kind of representing a large number of people. These are all the people that participated in this study, and this whole study, in this more comprehensive study of understanding the antidepressant effects, the long-term effects, and the acute effects of ayahuasca. And this is the closest group. This is the group that actually were working with the patients, and certainly part of what we are seeing as a placebo response come from the fact that this is a group that has something very particular, in my opinion, which is they like people. They are not afraid of people. So all the patients, when they left the hospital, they said, I felt well treated, and I felt safe, which are, in my opinion, very important to guide a safe psychedelic experience. I want to acknowledge and thank the institutions that took part of this project, the Brain Institute and the University Hospital from the same university, from the Federal University of Rio Grande do Norte. The University Hospital is a public hospital in this neighborhood, the very poor neighborhood in Natal. This work was 100% financed by the Brazilian government, by the Ministry of Science and Technology, and by the Ministry of Education. So I also want to thank and acknowledge their participation in this study. And with that, I conclude. I thank you for your patience, and I'm here to answer the questions I know. Thank you.
Thank you very much for your question. So I have two questions, and also I wanted to hear your opinion about something. So the first one is that I've been hearing rumors that so there are basic conservative experience, visual experience in the ayahuasca experience, and this has to do with fractal types and spirals and things like that. And I was wondering that I hear once in a conference of predictive coding and thing that has to do with the organization, like intrinsical organization of the columns of neurons on B1, and I wanted to know what you know about that, and if it's some.
Actually, I think we are far from having the same type of measurements in humans, of understanding and under the effect of ayahuasca. So I'm aware of this type of experiments. I'm just not sure if we are there yet to relate these findings with what we are seeing, as these seems to be a more complex and dynamic system, in the sense that you do have these geometric, but you also have more complex things happening kind of almost together.
Thank you. And the second one is regarding this phenomena of seeing thoughts.
Of what?
Of seeing thoughts.
Sí.
So there is, I'm studying cognitive fusion on meditation. And I was noticing that at some point there is a degree of awareness in these two, like, altered state of consciousness with the thought, like recognizing that the thought is there. Mm-hmm. But it seems to me that the difference, like, that could lead to the therapeutic consequence of ayahuasca and meditation in the other side, is that when you are in meditation, you recognize the thought as a mental event that not necessarily represents reality. But when you are in ayahuasca, there is an immersion in the content of the thought that you are realizing that you're having. So it's more like similar to a therapy of shock or something. So I wanted to know if there is some indicative in brain, like, measurements of this immersive state. Mm-hmm. Of relating the content of the thought.
That's a very nice question, because one thing that I'm really interested in ayahuasca is the fact that you don't lose the sense of reality when you come back to the Babylon. So those experiences that you had during the effects of ayahuasca, they still real when you come back, which is different from dreaming, for instance. And why is it that we become more aware to our thoughts? So what we believe is basically due to the fact that we are humans and we have vision. Vision is our most recognized sense as a testing of reality. So somehow the visions are not responsible, but it might have a very important effect in understanding on how you get the immersive state. Because if you see something, then that catches your attention. Very different from when you're in a meditative state in which you don't have the visions, specifically the visions. So, but I totally agree with you in the sense that awareness is something that's very basic and important to understand these effects and to understand why is it that ayahuasca could be used as a therapy.
Hi, Draulio. Thank you for your talk. I have heard that some people said that they die and born again during the process of the trip in ayahuasca. What do you know about that, or do you recognize some faces during the trip, and have you measured that, or you seen in your fMRI or EEG studies?
We did see some of the patients, like the one I just reported. There was a typical experience of someone that thought that they have died. But there are recent studies by an group in England led by Robin Harris, who had related these psychedelic experience with what he has been calling ego dissolution. So ego dissolution is a construction of what the feeling of death might be, which is dissolve your ego. And they have been finding that the experience of ego dissolution somehow relates to the therapeutic effect with ayahuasca or with psilocybin. But that's not very common with ayahuasca, as it is with different substances like LSD. With LSD, that's very common. And maybe this is due to the fact that with people that use ayahuasca in the religious context, they've been using that for years. So they escalate the dose in a way that you don't get too much, but you're kind of in the middle of the experience. So you're not going to get frightened very often by the experience. With LSD, then that's more different. It's different. So there's a lot more in these experience of feeling that you're dead or ego dissolution and that kind of thing. Yes.
Hello. Thank you for your talk. I think it's very important to keep on researching in this kind of medicine. We can't allow ourselves to lose this kind of medicine. And I have two questions. The first one is, what about the effects of the other molecules and plants on the mixture? Because the two main components, the two main plants, they also have some other molecules, so that could also be important. And I know that also the mixture have another plants from the Amazon sometimes, so that could be also like secondary factor maybe.
Mm-hmm. Okay, so this is the problem of working with plants. There's no way around it. The plants are constituted of many elements, and it's very difficult to conduct a scientific experiment considering 300 different elements and the balance between the concentration of these 300 elements. So the idea of focusing on these elements is basically because these are the elements that most likely correlate with the gross aspect of the effects. So the other elements naturally contribute to the effects, but maybe not to the gross effects of the gross effects, but more subtle parts of the effects. So yes.
And another question is more related to the work that people are doing in Imperial College in London with psilocybin and LSD. They are giving these substances to people not in a religious context, but in a medical context. And they found some increased activity on the amygdala, that they are proposing that is some kind of opposite effect of the normal antidepressant, that they try to reduce this activity on the amygdala. So taking out the religious context and focusing just on the neurobiological effect of the molecules. Have you seen some effects on the amygdala also with ayahuasca?
Yeah, we are studying it. As a matter of fact, this week we are doing it. We are exactly repeating what people in the Imperial College have done with psilocybin. And I don't know the results yet, but the interpretation I see behind this reduction of the activity of the amygdala could be more due to a so we can explain emotional regulation in two ways. One is a top-down and the other one is a bottom-up. So what's a top-down process of emotional regulation? Say that you have a stimuli that makes you sad. So it already reached you, and then somehow you're going to try to regulate whatever caught you, so, which is sadness or madness or whatever. So that emotion already entered your system, and somehow you're going to try to avoid it. You get mad with someone in the calle, in the streets. So if you get mad already, then you're going to have to work yourself out not to do anything because it's socially or you don't want to do anything. The other way of understanding emotional regulation comes from ideas, from meditation ideas, which I believe are probably are a better way to understand these type of results, which is the stimuli just did not reach you. So you did not get mad. Then you don't have to regulate anything. If you don't get mad, it's more of a bottom-up process. It just doesn't reach you. And very curiously, if at the end, on the last day of the experiment, we asked the individuals if they've found that something changed. So we had 3 questions. If something changed, if they say yes, something changed, we asked, what changed, then is your emotion. So we focused in the emotion. And then the third question was, we read a list of words, that had a lot of emotions, that had, and the only name, and the question was, does any of these words translate the changes you felt from Wednesday to today? And the only word that comes up is tranquility. It's very weird. The only word that comes up is tranquility. So tranquility, what is tranquility? When you feel tranquil, it's just that nothing just reaches you. You're tranquil. So if something bad happens, you're like, yeah, all right. So you're just tranquil. It's very interesting because it's a very kind of Bob Marley feeling, in the sense that at the end everything is going to be all right. That's the feeling we got from their experiences.
Hi. I want to know, in the depression study, did you evaluate the effects in the placebo group, separating by those who reported that had received the
Yes,
placebo or not?
we did.
Sorry. Okay. And then
No, go
I
ahead.
ask you. It's one question, so this is a composed one question. And in your fMRI study, I want to know if you included a perceptual task along with an imaginary task.
Yeah. No, we didn't. We only had, yes. We do have a perception task contrasted against the imagination task. So the task was like, so that you understand, the task was, it had 3 components. The first one was a real image, that the individuals would see that image. And then for the second part, they would close their eyes and try to imagine that image. If something appeared in their mind's eye more clear than the image we have just presented, they should just follow that image. They should follow whatever was more clear, was more vivid. And then the third part, we had a scrambled version of the first image. So this third part, which was the scrambled image, they saw a scrambled image, and we used that as a baseline. And what we found is basically that there's no change in those areas I've shown. There's no change in perception. And so if I compare the periods in which the individuals were looking at something with their eyes open under the effect of ayahuasca and without the effect of ayahuasca, this activity is compatible. And more interestingly, it's compatible to when they're imagining something with the eyes closed under the effect of ayahuasca. So these 3 periods are comparable, but not when they have their eyes closed without ayahuasca. Then the activity of these regions are reduced.
So we only have time for 2 more questions, 1 per person. So you and you.
You said that ayahuasca can help people that dealing with the drug addiction. Is this ayahuasca effect as strong as it was described with ibogaine?
Differently from ibogaine, there is no trial or ayahuasca is not being tested yet scientifically to understand its possible role in addiction, as ibogaine has already. So as we know, there are many clinics that use, or some clinics that use ibogaine clinically to treat people that have problems with addiction. That's not the case with ayahuasca yet. But there is one group in São Paulo who's just starting this project of evaluating clinically in both settings, both the religious setting and in a hospital setting, the effect of ayahuasca in addiction.
I want to know, you know, when you have a patient with a depression, usually if you take a brain SPECT, you can see hypoperfusion in the frontal orbital areas or frontal parietal areas. I saw in your presentation that you take SPECT in some patients, and I want to know if you have take SPECT before and after a treatment to evaluate the improve of the perfusion in that area.
This was taken before and 8 hours after. So this
8 hours.
8 hours.
But month or 1 month?
No, we haven't. No, we haven't. Then the correlations become a lot more subtle.
All right, thank you so much. We're running very late, so I'm sorry. You can continue talking on the coffee, which you are all invited. Thank you.